Hi, this is Kathryn Flynn, presenting on behalf of the LURN study group on do patients report their lower urinary tract symptoms accurately. I have nothing to disclose. Self-reported questionnaires and clinical bladder diaries are each commonly used to characterize patients with lower urinary tract symptoms. Previous studies have suggested poor concordance between voiding diaries and recalled reports of symptoms, but typically patients' recalled symptoms were collected as part of their clinical assessment before completing a voiding diary. That is, the time periods did not match. Our objective was to compare paper bladder diary reports to recalled responses over the same time period. We looked at daytime frequency, nighttime frequency, incontinence, and urgency. This is part of a larger recall study that lasted 1 month. For this analysis, we are using data from the 3-day bladder diaries, as well as the 3, 7, and 30-day questionnaires. For our bladder diary, we used a simplified version of the International Consultation on Incontinence Questionnaire, or ICIQ, 3-day paper bladder diary. Patients were instructed to complete the diaries in real time, though they may or may not have. Participants recorded voiding frequency, bladder sensation at voiding, incontinence episodes, and pad changes. No information on voided volumes or intake data was collected. Participants also completed a 15-item LUTS questionnaire electronically, consisting of items from the LURN Comprehensive Assessment of Self-Reported Urinary Symptoms, or CASAS. Here on the screen are 4 of those items. These are items that use a 7-day recall period, and item wording was the same, except for a different recall period for the 3 and 30-day item versions. 290 participants enrolled from 6 U.S. tertiary care sites. 29 did not complete the study, 90% did. 27 did not return a bladder diary, and 56 diaries could not be used for analysis because of mismatching dates. Thus, we had 175 participants, or 60%, who were included in this analysis. About half of them were women, and 85% were non-Hispanic white with a mean age of 59 years. We used correlation coefficients to assess the linear relationships between the mean diary responses and the questionnaire responses at 3, 7, and 30 days. Shown here are the results for frequency, with the questionnaire items shown on the left, the bladder diary metrics shown on the right, and there are 3 values for each, corresponding to the correlations between the bladder diary metric and the 3, 7, or 30-day version of the recalled questionnaire item. The vertical red lines correspond to correlations of 0, 0.5, and 0.7. So you can see here that for frequency, most of the correlations are above 0.5, or moderate correlations, and a few are at or above 0.7, indicating a stronger relationship. Of the 2 urgency items that we tested, the first showed a moderate correlation between diary and questionnaire, while the second showed a weak correlation. Here are the results for incontinence items. With the exception of leaking for an unidentifiable reason, which I've circled in yellow, the incontinence items had weak correlations between the bladder diaries and the questionnaires. In conclusion, our missing bladder diary data were common, highlighting the particular patient burden associated with this method of data collection. We were able to collect much more complete data from the electronic questionnaires. We found strong correlations between paper bladder diaries and electronically collected recalled reports for daytime and nighttime voiding frequency, but there were weak to moderate correlations for urgency and incontinence. And this was pretty consistent across all 3 of the recalled periods, 3, 7, and 30 days.